All right, guys, here is the overview for today's lecture on vaccinations or immunizations. So looking at, again, what is just the overall basis of immunity, that our immune systems help to protect us from illnesses, and that we have to keep in mind that not every patient that you will work with will have a healthy, functioning immune system. We talked about the risk populations of being the very young, so like those infants and toddlers, due to the fact that their immune system has not been fully developed. And then we talk about geriatric population because things as we age, the immune system is going to start to wear away. However, when you think about those middle ground folks, patients, it is those that are either immunocompromised. Like I said, you can have many different words: immunosuppressed, immunodeficient, whatever it may be, or people that do like they have that suppressed immune, or they have that autoimmune disease. They are undergoing cancer treatments through chemo, maybe radiation. They're a transplant person and they're on immunosuppressant drugs. So all of that is really incorporated into our patients, that when we talk about immunity and what can alter immunity. Again, you should have an idea of what the definition, or what does it mean for antigen, antibody, what the term for immunoglobulin is. And immunoglobulins, again, are antibodies, kind of like the same train of thought. We talked about that there with the antigens, there's many different types of foreign invaders. So it's not just bacteria and viruses. It can be parasites, cancer cells. It can be fungi. Okay. Okay. Just looking, we talked about the immunoglobulins already. All right, so this is kind of with slide 8 with immunity. So going that our immune system has so many multifactorial layers and just how it works together. And we have different types of immune systems in us. So when I talked about innate, or when we talked about acquired, and so forth. I apologize, my dog's going to bark. So one of the things with slide 8 was bringing in these multiple immune systems. So the first thing I would tell you is that in the innate, I-N-N-A-T-E, this is the immune system we are born with. These are the barriers that's going to assist the body in immunity that we are born with. Can somebody be born with a compromised innate system? Sure, right? So what were some of those things that are under that category for innate? And it was skin, tears, saliva, mucous membranes, mucosa, stomach acid. All of that works together. And so when those foreign invaders come against our innate immunity, hopefully these things are intact, they're functioning, and they can take care of that. It's kind of like when those bad guys can pass through that front line, pass through those natural barriers, then that's when, that kind of next defense system is going to come in. So slide 9, I said that you absolutely need to know, and that is the active and passive immunity. This is going to come under that immune system as known as acquired or adaptive, same thing. So with active immunity, and let me backtrack, with active or passive, they both have natural and artificial, okay? So with the active immunity, natural, we said it is when you come down with something, when you come down with that virus or you come down with that bacteria, you will develop the antibodies towards them. The artificial is getting the immunization for... I apologize, I'm trying to take care of my dog so they're not barking and you can't hear me. So I think I was with the active immunity. So artificial active was then again, as you get those immunizations, that will give you the antibodies. So when you get your MMR, you get your influenza, the COVID. I am getting that immunity artificially, okay? And then with passive, I said, think about is if I'm passing it along. With natural passive, that's mom to baby. So through the placenta, the blood through the placenta will provide those antibodies to that baby for X amount of time, and then you can get it from breast milk. The artificial passive is going to come from serum. So those again, is the immunoglobulins that are harvested from donors that will make up that specific immunoglobulin therapy that that person, that a patient would need. So again, the examples for the immunoglobulins, there's a slide on them that just gives you some idea of what immunoglobulins are available. So again, I use the example several times for a healthcare worker that may be stuck with a needle and we don't know if that patient has hepatitis B. So if we preventative from the healthcare worker coming down with that Hep B, they would go in, can get an immunoglobulin Hep B vaccine. And remember, this is important, that the immunoglobulin therapy, it bypasses that person's immune system because these are already those preformed antibodies against that antigen. And so that person who's getting the vaccination, again, they're getting those preformed antibodies. So the body's not having to rely on its own self to make these antibodies. It's a temporary kind of quick fix to a situation. Okay. Please go back over what is antibody titers. We talked about that because it is a test that really just basically goes, do you have immunity towards this virus, right? It can be used to determine, like, if you need a booster shot. I was telling you, like, how I had to go back and get an MMR shot because it really didn't show that I really had active immunity towards that when I had my titers done. Titers can also tell if you've recently or currently have had an infection. So for people that the healthcare provider is suspicious for them having hepatitis, you can do titer test, or if some other infection, and it can tell you if they've had they have an active current infection or they've had some kind of exposure. So that can be used for that way as well. The titer can also help in sometimes indicating autoimmune disorders. Okay, so again, basically that antibody titer is just used to determine if you've had previous infections or whether or not you need certain immunizations. Okay. We talked why are immunizations given, and as it was mentioned today, it's kind of like a preventative, right? It's preventative to help keep somebody protected from coming down with that infection, whether viral or bacterial infection. Okay. We talked a little bit about live versus inactivated immunizations, and again, it was more of the slide on 15 that is better for you. The one that's prior on 14, they had like the kind of graph that you don't need that, but 15, I bought that because it goes back again talking about live. People get vaccinated with live bacteria or virus and have the lifelong immunity versus the inactivated, and those are the ones that we can only get like a partial immunity, or the ones that we are going to have to do like yearly or every so often. So the influenza and the pneumococcal vaccine are examples of the inactivated. I think I was telling you a little bit, so on slide 16, a little bit more about the active immunization types that are available. I know I mentioned the HPV, and I told you that it has a high percentage to cause cervical cancers, but it also is the virus that is up to 90% responsible for genital warts, which again is a sexually transmitted infection or sexually transmitted disease. And so again, HPV can happen in both genders, and there is a vaccination for it. It is a series of 3, I believe, and you can start it anywhere from 12 up to 26 is the cutoff. Okay. All right. On slide 17, it just kind of circles back again of going, what is passive immunization? So again, think of it as is like you're borrowing it, or I'm passing it on to you and you're going to borrow it. So again, mom to baby or through those immunoglobulins. Biologicals, these is basically the medication or these immunizations are made from some kind of living organism. So whether it's an animal, it is a plant, it is a microorganism, it is a human. That's a biological. They're harder to make vaccinations, but they are very good and they very beneficial. And so those three things that we talked about of what is we said the biological is kind of that main label. Under it, we have what's called immune sera, and these immune seras are just kind of broken down then into those three categories we talked about. So you have your antitoxin, your antivenom, and your anti-serum. Okay, so we'll go over that. The whole purpose with immune sera, again, is because it is preformed antibodies, again, kind of like those immunoglobulins, but immunoglobulins are like really taken from like a human donor. And the immune sera is these preformed antibodies, but they're being taken not just from humans, but from animals. I hope I said immunoglobulins from human, right? No, okay. So anti-sera, again, can come from humans or animals who've had that specific disease and they've developed the antibodies to it, right? So they said we can take things from that person. They've had that disease. They have those antibodies. We can take it from them to be able to treat specific things. So with the antitoxins, an example for this one would be like your tetanus toxoids, your TD. Okay, and so those are specific antibodies to treat specific toxins that we have. The antivenoms, those were the immune sera that contain antibodies for specific venoms, so specific poisonous snakes or spiders. And so it's almost to me kind of like an antidote, if you will. So if you were to get a bite from one of these poisonous animals, the antivenom would be able to be given in order to counteract that venom that is in that blood system that could kill somebody. All right, and then so I'm going to backtrack for 1 second. With the biologicals, I really misspoke, but I just want to make sure I'm clear. Those biologicals, then like I said, is the label. Then you have immune sera. So the three immune seras are the antitoxins, the antivenoms, and immunoglobulins. It's just that immunoglobulins are harvested from a lot of human donors, where your toxins and venoms, they can be harvested from other sources than human. Okay, so that's what I just want to make sure that we're clear on. Like I said, there are 5 different categories of immunoglobulins. So when you're taking these antibodies for that specific person, they will take it mainly from this one type of immunoglobulin, okay? But you get into that next semester more so. So what we just are for you to know is, what is immune sera? There's these 3 types: the toxin, venom, immunoglobulins. Toxins against toxoid, like tetanus toxoid. The venoms against poisonous animals, snakes, reptiles, snakes and spiders. And the immunoglobulins are the perfect ones for people that have had like a needle stick, or they've had an exposure to something else that you have the immunoglobulin available, and they can get that as that quick fix, because again, you're already getting the antibodies that can fight off that foreign invader. You're not having to wait for your own body to produce them. So you can just go through each of those 3 individual categories and have a good idea of, again, what does that mean. On slide 23, there was just examples of immunoglobulins, and again, you do not need to know every single one specifically. I think for this level, the main thing is that we're kind of talking more for us is the tetanus, and we talk about the Hep B a lot because of potential for needle sticks. The RhoGAM one you will learn about in OB, because that has to do for mom to baby. So, okay. I would keep in mind, so what was the main goal, or what is that therapeutic action, or what is the indicator for immunization? So again, it is to activate an immune response, right, in people. And whether you're in a high risk category or not, that therapeutic action is I get the influenza vaccine, and hopefully I do not get the influenza that year. So that's a very therapeutic action or benefit. Okay. Please make sure you go back over contraindications. We said that there are times that when vaccinations are not always warranted, and so we talked about some of those special circumstances for people who we talked about, like head traumas, or if they're allergic to ingredients someone had brought up today. If they are currently sick, the provider might say, you know what, when you recover from this illness, and then you can come back and get the vaccination. If some pregnant vaccinations can't be taken in pregnancy, some can, but some cannot. So going back and looking at that contraindications and cautions before giving that vaccination to a patient. Okay. We talked about adverse reactions. So with this one, guys, it's a big focus with going adverse reactions, thinking of it as kind of like that extreme, the worst reactions versus, hey, I know these mild reactions can occur. We've all had these vaccinations. As we were talking today, we said, what are some of the things that you guys feel after your influenza shot? And it's like, oh, that muscle hurts, that arm hurts for a couple of days. Sometimes you might have a little low-grade fever, those body aches, or you might just feel fatigued. But what is that flip side where it is just a very bad reaction or a very hypersensitivity reaction? So we talked about serum sickness, and that is going to occur more with your immune sera vaccines versus the other ones, but it's still a possibility. And just knowing too that if somebody does develop any kind of respiratory distress, that's a medical emergency. So we always are anticipating, you know, that worst could happen. But we know that if they develop hives or itching or feel like they, you know, are having a little shortness of breath or feel more restless or something just out of the ordinary, it is something to contact the healthcare provider about, because that absolutely could be an adverse reaction, not just a, I just lost my word, expected, like I said, like the sore arm or something of that nature. Okay. So again, when you're thinking about getting vaccinations, the therapeutic action is, yes, you are getting introduced into the body, whether it's live or inactivated, you are still getting a foreign invader into that body, and you are still, that body is going to respond with an immune response. That's the job. That's what it's supposed to do. But again, normal pain, redness, swelling, maybe a little nodule formation is and can be anticipated. Think about if any of you have babies and the kids go and get their vaccinations, they can be very fussy for a day or two, crying. Sometimes they may run that low-grade fever. There's a little redness at the injection site. Again, so you have to really keep in mind what is anticipated or expected versus, oh, this is really bad. This is not an anticipated, or this is surpasses what should happen. Okay. We talked about patients who may be on immunosuppressant drugs, which includes corticosteroids, that they really would be contraindicated in vaccinations because, again, it will alter the body's response to the vaccine. They're on, like I said, you're getting a vaccine to produce an immune response. But if they're on an immunosuppressant medication, their immune system is being suppressed. And so, like I said, there may be those extenuating circumstances where the healthcare provider will say, you know what, we know they're on this medication, but the benefits outweighs the risk. We need them to have it. If you have an order, you know, and you're going to document, then absolutely. But in kind of that frame of thought to keep in mind, generally it would be contraindicated with immunosuppressive medications. Okay. The influenza shot, we talked about, are great at preventing the influenza. And so the flu shots are done yearly, and we do know that, again, anybody can come down with influenza, but we do have high risk populations, and for that one, more for influenza, and then pneumonia can be our higher geriatric is our higher risk populations. And so the influenza vaccine is a yearly, and why it is yearly is because different strains will manifest year to year, and scientists again will look at what strains were more prevalent the year prior, and that's how they're going to make the new influenza vaccine for that next year coming up. Tetanus shots, again, booster is usually like every 10 years. Okay. But again, somebody may get a booster sooner than 10 if there has been some kind of an injury that's gone on. I would go back, and I know when you're looking at giving these immunizations, most of them are going to be an IM, like in the deltoid. Now, the pneumonia one can go either way as far as sub-Q or IM. So I know we didn't touch upon that today. So when you're doing your reading, you might want to just kind of glance, okay, this vaccination is given, is it sub-Q or is it IM? And like I said, that why that's important is because if you really do have a medication that needs to go into that intramuscular and you're giving it as a sub-Q, that could really cause tissue damage. It could cause ineffectiveness for that vaccine to work for that person. And that is why we get very, I won't say used to, but that's why we learn what is the route, what is the recommended administration for this vaccine, okay? Because for the influenza, and I think it's still available, but I know I did it one year when it kind of became out brand new, they had an intranasal spray for the flu. So again, that's why you want to go, okay, what route and administration technique? We talked about when receiving vaccines, we do want to, a lot of times you're going to ask your patient, okay, which arm do you want it in? But we want to make sure that we are evaluating that if we're giving in the right or we're giving to the left, is there good blood supply? Is there any disability in that arm? Is that range of motion okay? And that perfusion, because you need a good perfusion in order to have that absorbency of that medication. We talked about some general nursing diagnoses. So again, it can be deficient knowledge. It can be pain because of the injection site. Again, we talked about that as you will, as a federal law, that you have to give that vaccination information sheet to your patient, and you document it in the EMR that it was given to them. When you go and document a vaccination in the EMR, guys, and you'll see this, but on the bottle of the vaccinations will be a lot number, expiration date, the manufacturer. And the EMR generally will have you put all of that into the computer. So if you're at clinical and you get a chance to give a vaccine, do not throw that bottle out. You will need that specific information off of that vial. And then again, as a nurse, don't throw the vial out until you have uploaded all that information into the EMR. Okay? We know that vaccines are not used to treat acute infection, right? They're used as a prevention for future exposures. When it comes to evaluating your patient, you want to monitor their response. We want to make sure that they've not had any adverse reactions, and that there's no problems, right? Just in general, when kind of evaluating the teaching plan for them. So again, like I said, you know, vaccines take a couple weeks to really build up that antibody response, and so you probably won't have your patient in there waiting to see that and all the so forth. But what you can evaluate is that they are able to tell you what immunization they're receiving. They can tell you what are going to be some potential side effects or some potential adverse reactions, which they would want to notify you with right away. All right, I think that does it. So if you kind of focus on what we talked about, and again, knowing with the immunities for that innate, which is you're born with, and then the acquired, so whether it's artificial or the active and passive immunity, so artificial or natural under both of those, and just more of the contraindications of who shouldn't, and just kind of education piece. Go back again over the biologics. So what is that immune sera? There's three categories: your immunoglobulins, your anti-venoms, and your antitoxoids. So when would each of those be given, in what scenarios? I think you'll be good to go. Have a great week.